It's been hot and muggy. It's supposed to rain more, maybe right when we're talking here, even. Uh, I have a special guest with me today, Jan Gauder, and with the Crosstown COVID-19 vaccination clinics, and those are in Naperville and Aurora. And I'm going to bring up Jan right now. She's going to give us some more details of what's happening out there. And I just appreciate her joining today. And I want to take down this little thing here, and we'll get right back to your Jan. Just 1 second here. Got too many buttons here. Button. Here we go. We'll get this button up. We'll put this one. We'll welcome her. Now this is what I got, Jan. You're under the Page Health Board, and you're CEO of a Equality and Health Advisors Network, and you really have a heart for you're a health consultant that works in trying to create relevant COVID-19 education and increasing that vaccination access, and of course reducing overall health disparities in our community. And that's what we got to talk about too here. That's a very important topic, the disparities out there. So, Jan, thank you for coming by.
Well, John, thank you for the invitation. How about that?
Yeah, okay. Why don't you just tell me a little about your work, and we'll discuss about the Crosstown COVID operation vaccine clinics. But why don't you just give us a little background in your involvement with this COVID-19?
Well, it actually began because of my commitment to mitigate health disparities. And for anyone who may not understand or know what health disparities are, it is the disconnect in our health system that treats people differently because of their race or ethnicity, because of their social economic status. And I want to bring that in because when we think about health disparities, so often we just think of those marginalized communities by race and by ethnicity. But one of the things we clearly learned at the onset of COVID is that our elderly, irregardless of race or ethnicity, are also suffering and unfortunately dying because of health disparities. My passion again is closing that gap. And John, as you know, COVID really put a very bright light on health disparities because we experienced as a nation, we experienced globally uh, a disproportionate number of, let's say, African Americans,
Right?
American indigenous people, our Hispanic Latinx population, even in some of our Asian population. Now, I want to bring this in because another group, we don't know what the health outcomes have been because we've not collected the data. And that is on our Middle Eastern and North African population.
Oh, really?
This
Okay.
is, yes, this is something that I'm working as part of the Heart group here in DuPage County, something that we
Oh,
are actively exploring. How do
okay.
we count all of our population? And that has to include our MENA/Arab population, especially when we consider that there is a significant number of our citizens who are from that region of the world,
Right.
either through their parents or are descendants and they are firstborn here in the United States. But my hard work is looking at ways, opening up that conversation that we all need to have in terms of how do we close these gaps? How do we look at our healthcare system, not just to criticize it, but to look at it in a way where we genuinely explore how do we improve it?
Yes. I have some Middle Eastern friends. Maybe I should connect you with them who are in DuPage. Uh, a pastor, and I know he maybe has some other connections too. I know that is an important thing from our. It's this, and I think Jan knows this. If we don't get this virus under control here, our African brothers, our Latin American brothers, even Europe, everybody, Asian, we got to get it under control. For this is a world pandemic. It's not just the United States, and we got to get more vaccines across overseas too, and that's a very important thing. And um, does DuPage Health have a? I know my friends who do work in DuPage, the VNA have. They go out to senior homes. Is there another group too, maybe that does that in DuPage? They go out to senior homes on the vaccinations.
Well, actually, DuPage County has been very, very, very progressive in
Okay.
initially making sure our elderly and our first line responders uh,
Mm-hmm.
receive the vaccine. We
Okay.
actually, in cases where patients cannot come out to any of the clinics,
Right.
DuPage County was actually sending nurses into a lot of our elderly homes, our homes. And remember, we also have, and I'm one of those medical homes because my son is profoundly disabled and non-ambulatory. So the nurses were actually going out into the homes. We also had a program where our EMS personnel would go out into homes or into pockets of communities, let's say especially for our elderly and or disabled, to administer the vaccine. I guess the most important thing here to say, John, is anyone who wants the vaccine, we can get it for you.
Okay,
I
that's
mean, we have,
good.
yes, we have worked tirelessly to make sure all barriers are addressed. It's just a matter now of getting the word out and making sure people know where to go. And where to go is as easy as your closest pharmacy, your whatever department store you shop at on a regular basis. The vaccine is available.
Yeah, I know it's out there, and yeah, and these clinics are interesting. I, but they've done. I know my friends at VNA. I know you're doing that too. One I know they mentioned one had one at a grocery store. Like, we. I know we're just trying to. Our healthcare people are trying to get these vaccinations out in every way they can, and uh, Jan, you've been working in the last week here or so about the Crosstown vaccinations. Now, what? Give us a little background and what you're doing there at that Crosstown operation.
Well, if I may quote Greg Hart, who's one of the DuPage County board members,
Right.
in
Mm-hmm.
a press conference about 2 weeks ago now, he said, DuPage County is unique, and I'm not saying Kane County doesn't have this wonderful dynamic, in
Right.
that we are a culture of collaboration.
Okay.
And what we have come up with for our Crosstown COVID-19 vaccine clinics, uh, targeting our students 12 plus, but also opening up the vaccine clinics for all of our residents. We came up with a wonderful collaboration between both districts, 203, 204, which is 204 is Indian Prairie School District, 203 is Naperville Community Unit School District, and the DuPage County Health Department, to create an event, a crosstown event, okay? And our focus is on keeping our community strong. As you alluded to earlier, there's a consequence we all pay if we have to go back into any sort of lockdown. We saw, 8, 9 months ago, the economic impact, not just the life, the daily cost of living. We saw what this did economically to our business structure. We don't want that. And the only way we're going to prevent that happening again is we all just buckle down, look at ourselves as a community with a desire to be a strong community. And a healthy community, a safe community, is a strong community. So we plan, and I think we did this in a little over 2 weeks, 2 or 3 planning sessions. And we especially targeted our Title I schools. And the reason for that is because the studies also show that for uh, members of our community who are African American, Asian, again, uh, American indigenous people, and Latinx, they tend to have more severe disease. Now, unfortunately, in many of these same populations, they also tend to have less trust. And we're finding that because of the trust issue, the robustness in getting the vaccine is not there. And we are trying to find ways to address that. So by targeting our Title I schools, we have areas or schools in areas where families may have a lower socioeconomic status. Some may be at the federal poverty rate and may not have transportation, let's say to drive out to Wheaton, or John Kane County's health department is in what, Geneva?
Yeah, they have some vac centers too. They have one
Okay.
right in Batavia right now. But yes, it's in Geneva. Well, it's actually in Aurora, their headquarters, even though Geneva is the county seat. But right.
Okay. Well, we're bringing it to you, and DuPage County has been fortunate enough, under the guidance of our very proficient executive director, Karen Ayala,
Okay.
to have a medical van now. They dubbed it the Care Van, bringing care to the community. Now we've done 4 of the clinics already. We have 2 remaining.
Right.
One is tomorrow, August 10th, at Mateo Valley. This is an all-day clinic starting at 9 o'clock a.m. And again, you can pre-register, or you can just walk in. We want to
Yeah.
get the vaccine in arms. And then the last one for this segment will be at Madison Junior High School in Naperville. And that's
Okay.
part of the 203 structure. Mateo Valley is 204.
Okay. Now, uh, uh, just because they're at schools, does that mean it's only school kids, or is it open to all those eligible people?
It is open to every eligible person who wants to walk up to that van and say, I want my shot of hope.
Now, if they by chance live in Kane, can they get this vaccination there too?
I don't think anyone's going to be turned away.
Okay. Okay.
Because our community is not, none of us live on an island.
No, I know people have gone to various earlier. I know a friend, a coach who in Batavia, him and his, yeah, he and his wife went to, they went to Pekin or somewhere to get, I mean, people went all over. They've gone all over to get vaccinations. Then we got people now that are just reluctant, and it's sort of strange that way. But so you got you're going to have youth. Hopefully we'll get youth there, right? That's one good. That's what
I mean, we want to get our schools open, right?
Right.
And we want to keep our schools open. And
right.
And the more students who are eligible to age 12 plus, the more teachers, the more family members, the more staffers who are vaccinated,
right,
the better chance we have of having school without those disruptions.
That's correct. Yeah. Now, you're offering 2 vaccines. I noticed the Pfizer and the J&J. I think the J&J, am I correct that that's a little, you got to be 18 and older for J&J?
Yes.
I think that's
18 and older for J&J. And right
and
now
that's a one-shotter, but you have to be a little
deal.
older for that
Yes.
one.
But
otherwise, they're 2 shots. Now, how does that work? Would you come back to the school, or are you suggesting that they go somewhere else,
No.
you got an appointment set up for the second shots?
we are going to email everyone and let them know when we're going to return to their campus so
Okay.
that they can get their second shot. But keep this in mind, and that's why you want to keep your card from the first vaccine. If you can't come that day, you can take that card and go to your local pharmacy or come to the health department and
Right.
still get your second shot.
Right. And what's the Pfizer? Is it, I forgot, is it 2 weeks in between the first and
I
second, or
believe
is
it's
it
three
three?
weeks. Three
3
weeks.
weeks. Yeah, I got my, I'll tell you, that earlier sign up was pretty tough. Here in Kane, I sure probably wasn't the page. They just didn't, they just weren't there, you know. And I finally got mine at Meyer store, and it worked out real nice, but that took a little while. And it's so nice that when you can have nowhere to go back for the vaccination, you know. Earlier on, I know here in Kane, they weren't, some of them weren't, they weren't doing that so much. They just gave you the day, the first date, and you fought to get back on the second one. They didn't really set it aside. And I don't think that was a good idea. And they scrapped that. So they did, you know, set up the second date.
Well,
Yeah.
John, let me correct myself. It's at least 21 days from your first dose for the Pfizer.
Right. I think you
But
said that. We
did
said
I
three
say that?
weeks. Yeah, we said
Okay.
3 weeks. Yeah.
Okay. I wasn't sure.
And then it's 2 weeks after that, I believe, to be fully, you know, set or
It's
vaccinated.
therapeutic after that second shot. 2 weeks
I
after.
think it's the same with the J&J too. I think it's two
Yes.
weeks
Yes.
after that. So, but that's limited to the 18 and above crowd. But that's 9 a.m. to 3 p.m. And yeah, I have a comment here. Yeah, here's an interesting. I want to just bring up this comment. I thought it was nice. We got to thank Mako Brooker here. She says, "Yes, we want kids back in school safely now." Isn't that true?
Yes, exactly.
And she also did a comment. Yeah, it is 21 days in between the Pfizer, and so that's 3 weeks. But one shot's better than no shots. Let's just
Yes.
if you get hit with the virus, well, one shot, I forgot the immunity. You know that it's something. It's 50% or I forgot.
Well, you know,
It's
there was a story in the paper. I want to say in the Washington Post yesterday. A couple who had the wife had actually received her first shot. The husband was refusing, and unfortunately, they both were diagnosed with COVID. The wife survived, and the doctors think she survived because she did have some of that protein in her body that gave her some protection. And unfortunately, the husband did not. And you know,
right.
when I read, and if you notice, increasingly, there are more stories like this that are coming to light. And that's because the families are saying to I want to say to the hospital personnel, I'll go public to convince people this is the right decision.
Oh yes, those are happening. I should. I think I could grab them from CNN or MSNBC or these people on in their beds telling people
Yeah.
get the vaccine. I mean, there's been last 2 3 weeks, especially. I've noticed that quite a bit, and loved ones are saying that. And why did we forget this? And just goes
And you
on
know,
and on.
and if I can, I would say I don't want anyone on a sick bed or a deathbed saying get the vaccine. Um,
Right,
so we're making it accessible. Now, I was speaking with one of our emergency room physicians a couple of days ago, and he shared with me a story of a patient who had chosen, this was a decision this man made to not have the vaccine. And
right.
as he was being advised in the emergency department that he tested positive for COVID, which was the explanation for why he was having such difficulty breathing,
Right.
He said, "Can I get the vaccine?" And the physician explained to me. I told him, "Not right now. Our goal now is to save your life. And once we do that, then you can get the vaccine." And interestingly enough, yes, there have been breakthroughs. I don't know what the most current data is, but there have been breakthroughs. But those individuals who chose to get the vaccine, even when there's a breakthrough, they are not experiencing what we normally call severe disease.
Right.
uh, they're down for a few days, and they're back up on their feet. And for those who are not being vaccinated, that's where we're continuing to see higher mortality and higher morbidity. And unfortunately, for a lot of our patients who have been diagnosed with COVID-19, there is what we call disease sequela, and that is simply as a result of COVID, they now have other diseases, vasculitis,
Okay.
they
Long,
have
that's long
diabetes,
termers or long haulers and
the
things
long
like that.
haulers, yes. And John, this is what I'm conflicted with. You can avoid this.
That's
No one
right.
has to have severe
No,
disease.
you
Okay. And
don't.
something I was thinking about earlier today, because I grew up in a Christian home, and we were always taught, love thy neighbor as thyself. So it's
That's
not
very
just,
true.
exactly, it's not just about me. It's about my neighbor. It's about my community. So, I mean, if ever there was a time when we could say we truly are a community, we truly are a village, and what is that saying? It takes a village.
But
This is that time we can all make a difference just thinking about our neighbors.
I think so. I think that's very, very true. What about, I want to ask you this. I had trying to persuade a young person to get the vaccination. He said, I didn't test him on this, but he said he'd had the virus. And he was maybe a senior in high school. And he was saying he'd had so he thinks, he doesn't need the shot. And his other buddy thinks that I'm just strong. I'm a young guy. I don't need that shot. You want to address these type of young people, this type of thinking?
Yes. You know what comes to my mind? Russian roulette.
Yeah, yeah.
Okay.
I think
Why
so.
take, I think life is a beautiful gift, and
Right,
how we wrap it is our choices. It's a choice we all make, right?
right.
Why would you take that kind of chance? I know a lady right now, she's in her mid 30s, and she was actually on one of our previous COVID-19 conversations. And,
Hmm.
and she was pretty much at the top of her career, working for one of the largest hotel families in the country, probably in the world,
Right.
traveling all over the world. And she contracted COVID. Now, she did contract it before the vaccine was available.
Okay.
And she's now on medical leave. Okay. I mean, she has so many medical concerns right now. And who's to say where this will take her and
Right.
what kind of outcome she will have? But she is now pretty much disabled, and she's on a medical leave. And who
Wow.
knows how long that is going to take before her company just cuts her off. Fortunately, right now they're being very generous with her, allowing her to maintain her salary, but she cannot work. She cannot. She has such short term. She's not 40. She has such short term memory until you can say something to her one
Hmm.
minute and the next minute. And John, it's not age. We do this because of our age, right? But the
Well, I
next,
was I was worried. I mean, well, it isn't
no,
quite there yet, but it is. I do lose it sometimes. Okay.
yeah.
Yes.
But I
Yeah.
mean, it's just heartbreaking that,
Right.
and I'm doing some advocacy for her now, but it's just heartbreaking to hear young people whose lives have been turned upside down, And again, in this young lady's case, the vaccine was not available at the time she contracted COVID. Okay.
Right,
But
right.
if you have an opportunity to make a difference and to get this vaccine, and you choose not, I mean, that's a heavy cost to pay for that kind of a decision.
Oh, and well, this idea that you've had the COVID, you still don't need the shot. There's no sure data on how long your immunity lasts from having COVID, and it's not a smart thing not to get the
No.
vaccination. Uh, and I hope these young people will get into it. I'll say their school district, and then they'll be in. Maybe I
Well,
shouldn't say that.
but if not, if you don't do it for yourself, do it
Right.
for your
Oh,
mom, your
that's the
dad.
thing.
Yeah.
No, those young people were thinking. Yes, I think that's their thought too. They're not thinking about others, and if they're Christian youth, they should think about their friends and everybody. I mean, that's part of Christianity that you were just talking about, to love others, and well, it should be everybody's thought, but definitely Christian youth should be thinking that way, and that is very important. And we put up that other school here, that junior high. So you got two vaccinations this week. Tomorrow at Matia, I'll put that back up again, Matia, and then later we got it at the junior high. You have it at a junior high there, and that Matia is all day almost. So
Yes.
that really should that's really good. It's and you said if you don't, I don't have the flyer, but you can link to this bottom screen that I have down there, and that will get you registered. You can do it that way, or just show up. And they're 9 a.m. to 3 p.m. That's a good length. And then on Saturday, which I have a lot of things with my friends, Saturday's a big day. A lot of things happening around here. Madison Junior High School, and that's in Naperville, and the other one was, well, it's in Aurora. 9 a.m. to 1 p.m. So that's a little shorter, but that's a good day too. And uh, we're our 12-year-old. I'll just if you got a few more moments, we're just
Sure.
discuss about the younger people, about our 12-year-olds and younger, or 11 years old and younger, and the needs there. I've heard that they might get this full, I guess, quote, authorization maybe in the next few weeks, maybe. And maybe that would, and then I think they'll have guidance on then. They'll have guidance maybe on the younger people too.
Well,
So what?
from my understanding,
Uh-huh.
what they're studying with the children, I think it's between ages 6 to 11, is
Right.
what is the correct dosing. It's
Right.
not
No, it's definitely the dosage, because yeah,
yes.
I mean we know the whole thing works. It's just how much do you give, right?
So
Right.
once they figure that out and get the approval, we
Right.
will immediately begin to roll out vaccines for that age population.
Right. So these young people, we got to protect them. So that's another reason to get the vaccine. The parents should get it. These kids, the only way they can be out in the public really is masking. I mean, they really should be masked if they're in a closed setting and at schools. That's about the only thing that's protecting them, and social distance, and of course washing their hands, etc. But the virus seems, basically it's mostly airborne, right? Correct. I mean, there's some on surfaces, but it's mostly airborne, isn't it? Isn't
Yes,
it?
yes, yes, exactly. Now, if I might just say this, because there is some concern about our children who may be living with disabilities or comorbidities and may find it difficult to wear a mask. I mean, and that
Oh,
can
okay.
even be for
Okay.
some
Right.
adults,
Mm-hmm,
okay?
mm-hmm.
And what I say to that is because that's real,
Right.
okay?
That can happen. Right. Mm-hmm.
However, let's show we really care about these children. And for those of us who are able to wear a mask, let's don the mask. Unfortunately, and the studies do show this, children who have disabilities or existing comorbidities are more likely to have a what we call a hazard outcome because
Okay.
if they contract COVID. And part of the reason is because some of our youth who have disabilities may not be able to communicate and comply with the things that their doctors need them to do. So that makes treating them that much more difficult. So, in the interest of those children who have disabilities, those children, whether they're cognitive disabilities, emotional, mental, or physical, for those of us who can wear our masks, for those of us who can get the vaccine, please let's think about out of a sense of just being a really good neighbor. Let's think about let's do it for them. And if you're still questioning if the vaccine is safe, just look at the numbers. Fewer people have died since the vaccine became our reality. That's the bottom line. Now, unfortunately, with the Delta variant, we are seeing an emergence of sorts of morbidity and mortality, but especially with the mortality, those are almost 100% of people who did not get the vaccine.
That's correct. That's
So
correct.
think about it. If you're able to get the vaccine, do you want to risk your life or even the quality of your life? Because it doesn't kill everybody. A lot of people survive it, but they survive it with other illnesses. Is that a risk that you can afford to take?
Right. That long hauler thing, and I just think of that. I don't. Maybe you heard this. The ex-Cub Anthony Rizzo. I get that. He's got COVID. You heard that? Did you hear
No,
that? Yeah, they just found that out yesterday. So I'm assuming he's going to be down maybe 10 days or something at least. But said it's minor right now, but you don't know. But that, you get it. He might have, you don't know.
you
The
don't.
long haul effect. You don't know. It could. I think there was this one ball player, and they showed that it had hurt his running abilities. I forgot how that was, but I think it took him a while to get back because his running ability was just, his lungs were not good. And anyway, it could be a lot of other things too. We just don't know about this thing. And sometimes it could get to your brain. They don't know why that is. Maybe that's lack of oxygen, or maybe it's just the way it works, or they're not sure. They've seen some. I guess that's white. How was that called? White.
The gray matter?
Yeah, gray matter in your brain or something. That happens, and they're not quite sure how that happens. But
Well,
it could be.
it's something about the connection of oxygen to the
It could be
brain.
the oxygen. That's what they're saying. Yeah.
Okay.
Yeah, you missed some oxygen there with the COVID, and that could do that. So there's many things out there, and we'll hopefully have Jan back again real soon, and we'll have more updates on what's happening here. We had a very good conversation with her here, and I'm just going to show a few more things here, just really quick here. Just hold there, Jan, 1 second. Wednesday, we're going to have Teresa Shoemaker, Lord willing. And then on Friday, I'm going to talk with Sonny DeRama of the VNA, how things are happening with that group. Same idea. We're going to keep pushing on this, and I want Jan to come back because we got to keep pushing on these things. And here's a couple events coming up. The big one is a back to school fair at Phillips Park, and they're going to have the VNA is going to have a vaccination thing there, and there's a lot of good stuff your kids can get. Maybe up to 2,500 kids are going to get served. So look on. I didn't put up the flyer, but we'll have more of that. You can get that online. with cities and schools, Aurora. And then there's another back to school. There's a lot of people doing it back to school. Here's another back to school fair on the west side at Greenfield Park in Aurora, and that's on Friday night. And they're going to have vaccinations there too, I believe. And they're going to give, it's not as many as the other group would, but it's a nice back to school fair with several aldermen are putting that together in Aurora, and that's on the Aurora west side on Illinois. So I just want to thank Jan for coming by here, and this has been a beautiful time. And I thank you for the interaction there from I assume that's Miko. Thank you for Miko for your comments, and that was very nice. And so Jan, just thank you very much for coming by.
Well, John, I thank you for creating this opportunity, and I applaud you for your efforts to get more people vaccinated. And I'm sure that you would agree with me, and I'm going to quote someone who said, "I'm just trying to keep people alive." And that was our Karen Ayala, who's executive director at the DuPage County DuPage County Health Department. That's what we're all trying to do, is just keep people alive. And if you have the opportunity to get this vaccine, please do so. If you need us to step in and to help organize, you can reach me through John. But we are working together, and we are community strong, right, John?
Yes, we're going to keep this up. And I got to put this up. One more. We're going to hold it here. Yes. Thank you, Miko. She liked our talk. Thank you. Thank that sister there for that. Yeah. So Jan, again, thank you so much for coming by. And it's just been a beautiful conversation, and we'll keep this up. And that's all I can say. We'll keep it up till the next time. That's on Wednesday, Lord willing. And so all I can say right now to all you out there is God bless. Bye-bye. And again, thank you, Jan.
Thank
Bye-bye
you.
now.
God bless.
Bye-bye, everybody.